Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa, as well as Hair and Scalp Wellness. I am so excited to be here with you today. We are doing a beautiful show on orthopedic surgery, and I have a wonderful guest, Dr. Ahmed Siddiqi, who's right here from JFK Brielle Orthopedics and Hackensack Meridian. So thank you so much for being with us today, Doctor.
Thanks so much for having me.
We're excited to talk about all that orthopedic surgery has to offer and how we can help our clients at home with that. So tell us a little bit about yourself.
So I was born and raised in New York. I've been back in this area for a little while, so this is home away from home for me, and I'm happy to be back. I do hip and knee replacements and redo hip and knee replacements. I'm part of Orthopedic Institute Brielle, where we have a lot of offices throughout New Jersey. Our closest office around here is in Edison. And the types of patients that I see are patients that vary in age. They're as young as 20, 30-year-olds and older as over 90-year-olds. And there are patients who come see me for debilitating hip problems, hip pain, knee pain, and if surgery is something that they're considering.
Wonderful. So you do the surgery. As far as a client that has some signs of needing some type of orthopedic surgery, give us an idea of what that might look like for them. What are some of the symptoms that might lead to them coming to see you?
Absolutely. So pain is usually the first symptoms that people usually feel, whether it's in their knee directly or in their groin or their hip area. These are pretty common. Early signs of arthritis, pain is usually the first hallmark feature. The second thing that really couples with the pain is stiffness. Usually it's in the morning time or evening time. Usually during the daytime when people are out and about, they don't really feel it as much, but the first couple of moments as soon as they wake up in the morning and when they're laying down to go to bed, that's when they really start to feel the stiffness. After the stiffness, you might see some swelling. Swelling happens as the arthritis progresses a little bit. So between the pain, the stiffness, and the swelling, these are all features of arthritis in the hips and the knees.
So as crazy as this might be, I'm going to ask you the question. So what is arthritis?
That's a great question, because that's the number one thing that's plagues
you hear
America.
about it a lot.
Exactly. So actually, back pain and arthritis are the number 1 and 2 causes that patients see an orthopedic surgeon about. So what arthritis is, it's basically the breakdown of the cushioning between the two bones. So in your knee, for instance, you have your thigh bone and you have your shin bone. The cushioning between those two bones is a piece of cartilage or several areas of cartilage. When the cartilage starts to wear away and you ultimately have no more cartilage left, that process is called arthritis. So when you're bone on bone, there's no cushioning left.
And there's no way to rebuild that cushioning with, I hear of these gels and all these other things. So people would be trying these alternatives before coming to you for surgery?
Absolutely. So there's a lot of different injections, medicines out there that are aiming to alleviate the pain by decreasing the inflammation and the swelling. But there's no medicine still in 2023, soon to be 2024, that really builds up the cartilage yet.
Wow, unbelievable. So the arthritis is the main cause for the pain.
Absolutely.
And you can have arthritis in different forms, maybe small amounts where you might feel a little bit of pain, and then something as vast as this?
Absolutely. And there's different kinds of arthritis. There's osteoarthritis, which is the basic and most common form of arthritis, where it's the wear and tear. Usually the high-end athletes from their high school and college days have really, taken a beating on their hips and their knees. And as they get older, they stay active playing golf and tennis and pickleball, which is their rage now. And as time goes on, that kind of can lead to the breakdown of the cushioning in their hips and their knees. The other types of arthritis are more medicine related, so more biology related. You have things like rheumatoid arthritis, things like lupus, things like psoriatic arthritis. These are more biologic in nature. These are things that are hereditary. So you might have gotten it from your mom or your dad. And a lot of times rheumatologists deal with these issues, and oftentimes medications help with some of these symptoms and the rheumatoid arthritis as well.
So when a patient comes to see you, doctor, have they usually exhausted pain management, maybe even physical therapy first? Or would you say that they will come to you having pain and you just do an x-ray and kind of can see that that deterioration has already occurred?
Usually it goes both ways. There's some patients that come see me that have exhausted all the injections and the conservative options. They've seen the rheumatologist, they've seen the non-operative pain management doctor or the sports doctor or the arthritis doctor, and they're to the point where they would want to proceed with surgery and they come see me. And there's other patients that want to see me directly who have not had a full workup. We get x-rays, and depending on what their x-rays or imaging shows, then we kind of set up a customized plan for them.
Okay, so my next question is, if you have a hip issue and you have to get one hip replaced, do you always have to have the other one done, or is this sometimes not a collateral situation?
So it's very interesting. There's been a lot of research in the past 5 years that's been looking at correlations between one hip versus the second hip, or the one knee versus the other knee, and honestly there's really no relation. We can't figure out why, which side, does a right hand dominant, does that right hip wear down more than the left hip. There's really no correlation or association. Chances are usually it's just one side, but there are instances where people have two bad hips and they have to get them done as well. But most commonly it's usually just one or the other.
Do you sometimes have to take a patient and keep an eye on the other side, or is it something where they're not coming to you anymore and then they just come back if they have another issue?
It's usually only if they have an issue, and what I tell patients is they can have really bad arthritic hip x-rays and knee x-rays, and if they're not having these symptoms, then we don't do anything we don't do anything at all for them. It's a pure quality of life and their symptoms that we're managing. It's not necessarily the x-rays that we're managing. X-rays tell us one portion of the whole story, but if a patient is not having much pain and their quality of life is not really affected, then I encourage them to live a happy life.
Wow. So what makes you so wonderful and different is that you also do robotic surgery, which they say can be less invasive and easier time to recover for the client. So tell us a little bit about your robotics and why you specialize in that.
Absolutely. So I did a lot of non-robotics, and now I do a lot of robotics as well. So I've had a direct, in my own patient population, I've been able to see the effects of robotic surgery and non-robotic surgery. And I'd have to say that my robotic patients recover way quicker than the non-robotic patients. I think robotic surgery is more precise, it's more accurate, and it's a tool that allows us to basically do surgery on a more personalized and individualized level. So not every knee is the same. Even if 5 patients, their x-rays look very similar on exam, they look very similar, but there's little nuances that are very, very different that you really appreciate once you're in the operating room doing the surgery itself. So what robotics allows you to do is it allows you to really custom tailor it to that specific anatomy to every single patient.
Amazing. So is every client a candidate for robotics, or when would you have to say no, unfortunately I can't do surgery that way?
I think when you're looking at severe osteoporosis, I think that's the only thing that really concerns me for robotic surgery. There's a few extra things that are required for robotic surgery, extra pins here and there. So if your bone is very, very soft to begin with, that's always a concern. But the way we're able to manage osteoporosis with the rheumatology doctors and the endocrinologists, we're not really seeing that anymore. There's a lot of good medicines out there that are really building up strong bone. So that's the long-winded answer to your question is, in my opinion, everybody's a candidate for robotic surgery.
Wonderful. And you prefer to do that?
Absolutely.
Excellent. For both the patient and because of your technique with regard to that?
Absolutely. I think the way we do robotic surgery, we've gotten a really long way over the past couple of years. Robotic surgery has been around for 20, 30 years, but the technology available to us now compared to where it was 5 or 7 years ago, it's night and day. We're very efficient with it. We're able to do a high volume with it as well.
Yeah, wonderful. So they say this AI, everyone's afraid of it, but we need to open our minds.
Absolutely.
And think about how wonderful it can be to help us move forward in life.
Absolutely.
So you can do the robotics right at JFK?
Yeah, we got the robotic technology there. We've been able to build that program over the past couple of years, and now it's it's a full-grown program where we're hiring surgeons, we're joining surgeons. People are coming to JFK, not only the patients but surgeons, to perform, to be a part of this robotic joint replacement program.
Yeah, well, Hackensack Meridian definitely has that also in the Woodbridge location, I know. And is it difficult for you to find a surgery center or a hospital, when you're dealing with a specific client, or do you have, availability at different places?
I think we have availability at different places. Some of the different facilities have different options available, but in this day and age where the consumer, where the patients really demand and have control over the market, I think Hackensack Meridian has done a really good job at keeping up with the demands of the patients in society. So a lot of the facilities have very similar technologies available to us.
That's wonderful. So how is the surgery recovery? Is it same day, or do we stay overnight, or how does that work?
So I can't tell you the last time I've had a patient of mine really spend the night unless it was an absolute medical reason. So 99.9% of my patients actually go home the same day. Whether they're done at a surgery center or at the hospital, they're pretty much going home 6-7 hours after surgery. That's a testament to the whole package combined. It's a testament to how we control patients' pain. It's a testament to how we're educating our patients ahead of time. It's a testament to what robotic surgery has allowed us to do. It's allowed us to be more minimally invasive. It's caused us not to cause more pain to patients after these major operations. So I think the whole thing involved, it really allows patients to go home the same day. And honestly, patients want to go home the same day. They don't want to be around sick people. I think the best thing that the pandemic did to orthopedic joint replacement patients is it really encouraged them to go home as quickly as possible. And as soon as that was happening, outcomes across the board, actually across the country, started just going up and up and up. And we've been able to really capitalize on those similar trends here in New Jersey as well.
Yeah, that makes a lot of sense, and the best way to recuperate is in your own home. But there are things that your patient needs to be educated about. Of course, is all of that home care and recovery, which I'm sure in the first few hours they better have somebody there to help them along. But they do have to move.
Absolutely. I think moving is the key. I think when you used to think about hip replacements and knee replacements almost 20-25 years ago, I remember when my own grandmother got it 25 years ago. It was pretty much you have to be in bed for 2.5 weeks. You have to let this incision to heal. Then you may have to get out of bed to a chair, and then you might consider walking 4 weeks after surgery. Now, if somebody's not out of bed within 2 hours of surgery, it gets me a little bit anxious because I want them to be out of bed as quickly as possible. So the more you move around, the better you'll recover. And the other thing is, I think patients, they're getting these knee replacements and hip replacements because they want to live a happy and active lifestyle. Patients are getting younger. They're doing more things. The average 75-year-old patient in my practice wants to go back to playing golf and pickleball. So they're not getting this to just stay in bed after surgery. So I think with their mindset and the way we really encourage them, they're getting up and walking right away.
Absolutely. Is there any other protocols to wellness that they need to keep track of? I mean, for weight, for dietary, for pulmonary, what are the things that you have to advise them about? Absolutely.
So we have a full nutritional program for patients that sign up for surgery for me. So they start on certain protein supplements ahead of time. We have them take zinc, we have them take vitamin C, we have them take vitamin D. I think it's very important to stay up to date on all the vitamins. It helps with their immune system. Having a good immune system helps with wound healing. It helps with their well-being. It helps with the way they're feeling as well. The other thing that I've really started to do is I've encouraged patients to take certain protein supplements. They're essential supplements, and it's with a particular brand that I work with that has really shown to help with wound healing afterwards. So between the vitamins and the protein supplements, it really, really has done a beneficial job in the way their incisions and their wounds are healing. And not only that, patients are feeling well. The idea behind starting this before surgery is pretty critical because they're already in the habit before surgery, so it's easy to continue after surgery as well.
I love the integrative approach, and it's important, and it's wonderful to hear a physician talk that way about medicine too, because we need that now. We need to think about the wellness end of it so that we're not in a situation, that one thing leads to the next. And surgery is a scary thing, and it's an invasive thing, but if you can handle it with that bit of integrative medicine, I think that it's a better outcome all in all.
Absolutely. I would completely agree with that. I think when people come see me, it's the whole package that they get. They don't just get the surgery side of things, but they get the nutrition side of things, they get the wellness side of things, they get the mental side of things also. Half the times when I'm talking to patients about surgery, I'm really keen to dialing in on their mental psyche, where they are with that, because you can go through the program, you can go through the motions of everything, but if mentally you're just not there up to par with what you're undergoing, then patients are just going to be unhappy. So it's important to tackle all the different aspects involved in this, because it's a true holistic and human experience.
Absolutely. Well, that all sounds very amazing. We're going to take a short break, and I'll be right back to speak to you a little bit more.
Great.
We'll be right back. Welcome back. So Dr. Siddiqi, tell me a little bit about the apparatus that is the replacement that we're putting into the hip or the knee.
Yeah, absolutely. I think when they first came up with the word replacement, I think it was a big misnomer. We're not really replacing anything, we're really just resurfacing the ends of the bone. So for a knee replacement, for instance, what we're doing is we're shaving away the ends of the bone of the thigh bone and the shin bone, and we're capping the ends like we're capping a tooth. So it's not like we're chopping the ends of the bone off, which what it sounds like is more of a resurfacing thing. Same thing on the hip side, where they're shaving away the ends of the bone and we're just capping it like we're capping a tooth.
I was envisioning like a new hip or a knee.
Yeah.
So that's not what it is at all.
Not entirely, no.
Okay. And what happens if one of these apparatus that you're kind of, replacing or shaving should need an adjustment in some way? How does that work?
Yeah, so, there's a small percentage of patients that end up needing redo surgeries. This redo surgery is called revision surgery. So a revision hip replacement or a revision knee replacement is basically where you have to do it again. And there's different reasons for it, whether they become loose or their ligaments stretch out and they're not as stable anymore, or if, God forbid, you have an infection. These are all different reasons why it might need an adjustment or have a revision surgery. I happen to do a lot of revision surgery. There's certain techniques and principles involved based on where I trained that I've really incorporated to Hackensack Meridian and built out a nice revision practice as well. The first thing is, if you're still having a lot of pain, if you're having a lot of clicking, if you feel like one of your legs is longer or shorter than the other, these might be reasons why to see a orthopedic surgeon that does a lot of revision surgery, to see if that makes sense for that particular patient. But yeah, so I do a lot of revision work as well.
And you find that in an MRI, in a sonogram, in an X-ray? What is the best way to see what the problem is that needs to be revised?
It's usually a combination of different studies. So X-rays is usually, the first line of thing that we do get. Sometimes a CT scan is better, sometimes an MRI is better, sometimes a bone scan is better. It really depends on the type of symptom or concern that the patient has, coupled with what we see on the X-ray, that I really determine what further sort of imaging study that we need.
And if you've had a hip replacement, let's say 5 years ago, do you have to upkeep on having some type of sonogram or MRI to check on that? Or is it something that unless you're feeling something, you just assume that everything's good?
It's usually, if you're feeling okay, you just kind of leave it alone. For my own personal practice, I usually tell patients to come see us every 3 to 5 years just to make sure the x-rays are looking okay. The parts that are going in now are proven. They've been around for a very, very long time. All the lab testing show that the hips and the knees, 20, 30 years simulated testing in the lab, they tend to do okay. Some of the parts that we're using now, the technology's been around for a long time. We've just upped the technology a little bit, but the basic premise of the implants themselves have been proven for a very long time. So just for my own personal sake, I just tell patients to come back every 3 to 5 years just to make sure they're doing okay. Plus just to see how they're doing and to catch up with them anyways, because every patient that I do surgery on, it becomes part of my extended family. I like to know what's going on with them. I like to know when their birthdays are, if they're having any significant milestones. It just makes you feel like that you're a part of their lives as well.
And that's wonderful. And you never know when they may need something else, or even just a referral to another doctor. And that's what we appreciate so much about you being part of this community, especially here in Woodbridge, because
Absolutely.
We're so close to Edison, and there's so much to offer by way of medicine. It's not run to New York anymore if you don't want to, because we have so many wonderful professionals right here in our
Absolutely.
own backyard. So
Absolutely.
tell me, you're so passionate. What made you pick orthopedics?
So I've kind of always had a inkling and tendency towards orthopedics. I think I was very close to my grandparents growing up, and seeing my grandma go through this 25 years ago and the evolution of the way they used to manage rheumatoid arthritis, and she had really severe rheumatoid arthritis. The medicines, they just weren't as good back then. Knee replacements were just coming around, and they were really saving lives actually for some of these rheumatoid patients. So having her gone through that, getting her up and walking, the way she recovered, it was very inspirational to me. And I knew that I wanted to make some sort of similar impact as a career on people. So I gravitated towards orthopedic surgery, and just doing joint replacement was just the natural progression of that, because now I get to do that every single day.
That's excellent. How many surgeries would you say you're doing in a week's time?
We do about 18 to 25 joint replacements a week. Yeah, so we do a lot.
There sure is a high calling for it. And I'm sure pickleball is helping.
Absolutely.
But it's great that people remain active. And of course, I think keeping their weight down, as far as wellness issues are concerned, I guess the less body weight you have, with our obesity, epidemic in this country, it's important to, I guess, talk about some of the preventative measures to not needing to have this, maybe 25 years down the road. So what would you recommend to somebody who's maybe in their 20s and 30s right now, listening to us, on what they could do to remain fit?
Yeah, I think living an active lifestyle is always between diet and exercise. So it doesn't mean you're in the gym every day, 3 hours a day in the gym, but just keeping an active lifestyle, run, do some cardio, do something. The worst type of, the thing that can get you in trouble later on in life is just kind of being a couch potato, right? That's were some of my memories of some of my friends' grandparents, where they would just kind of, not live a very active lifestyle. So being active is very, very important. As you get older, it gets even more important. I think it's very easy to tell a college, kid to stay active, but it's a little bit different when, you and I are working to stay active, because it goes beyond just doing the motions at work. You have to get out, walk, you have to get the vitamin D, you have to get the sunlight, you have to eat properly. It's important, I think, people in our age group to be a little bit more active than people that are a little bit younger. And as you continue to get older, to be cognizant that you want to, keep up with some of those activities as well. The second thing is you want to eat right. Junk food is certainly delicious, but you want to have a well-balanced diet. You want to have your proteins. You want to have, the small fatty intake as well. You want to have your carbs. If you go one extreme over the other, that's when you get into trouble. You want to have a nice, well-balanced diet, well-balanced active lifestyle as well.
Well, even just that weight shift, like if you're one of these, wafflers that goes back and forth, that can't be good for your joints as well, I would think. Absolutely.
I think every pound that you have, it's nearly 7 to 9 pounds on your hips and your knees. So if you just lost 1 pound, that's 7 to 9 pounds off your knees, which is substantial. So I don't diminish weight loss by any means. Patients come see me, they say, oh, what do I need to lose? 50, 70 pounds? And I tell them, start off with 1 pound, right? And then lose another pound, and then lose another pound. And then collectively, before you know it, you might be 30 pounds down. But if you just get caught in a number about what you have to get to, that's where patients don't make that first step.
Well, it's overwhelming.
Exactly.
And, honestly, when you're having the pain already, you might be gaining weight because you're not being active because of the pain. So it's a bit of a double-edged sword. I know, with family members of mine that have been going through back pain or it's hard to make that first step then to get active because it hurts.
Absolutely.
But that's when they should nip it in the bud and go see someone right away.
Absolutely.
As opposed to waiting a year while you put on 15 pounds.
Absolutely correct. I'd agree with that.
So I think it makes a lot of viable points to the wellness issue also. So it's been so great speaking to you, and I know that clients will love to come and see you right here at JFK, and I'm sure that you've educated many of our home viewers on these issues, because many people, from the amount of surgeries you do a week, will be needing a knee or hip replacement.
Absolutely.
So we're so grateful to have you right here in this community too, and part of the Hackensack Meridian Network as well.
Thank you for having me.
So I wish you the best, and thank you again for coming. And thank you all for joining us here on Wellness Woodbridge. We hope that we educated you today on some of the issues of orthopedic surgery. And you can always go and look up Dr. Siddiqi. He's amazing, and he's right here in our Woodbridge community. So thanks again for coming, and we look forward to seeing you again soon.